Feminist News Network, the feminist news that's right for you. Welcome to Sky in the Studio. All right, you know, if I have to come to the studio, it's got to be important. Important enough for me to put it together for you to get the information you need to use. So thanks for watching, thanks for subscribing, and if you haven't, please do to the YouTube channel. All right, Feminist News Network. Now, what's important to most women, to all people, to feminists, to Americans? What happened this week with a judge in Texas saying that the ACA, American Care Act, is unconstitutional. Ugliness. It's almost a debauchery of justice. Now, Democracy Now! Just so happened to have Ralph Nader on. And he said some very, very important words in regards to the ACA Act and what happened with the judges and what should be able to happen with it, which I agree with totally. And he didn't have to tell me to let me know that this needs an appeal. Now, we're going to take a look at this and then discuss. These GOP is a hot mess. Okay, let's take a look. Texas. Okay.
Is this Texas federal judge, yes, nominated by President George W. Bush, but confirmed by a Democratic Senate. This judge calling the ACA, calling Obamacare unconstitutional, and what this means.
I think it's going to be overturned. It's almost unanimously condemned by legal experts from all sides. It's a considered intellectually bad opinion by conservative legal scholars and denounced even more vociferously by progressive legal scholars. And it doesn't have an injunction in the country, so there's going to be no changes unless on rehearing the judge really goes off the rails. But then I think he would be overreaching in terms of his own jurisdiction. So we'll wait for the Circuit Court of Appeals.
So the Circuit Court of Appeals rules, and then it could go to the Supreme Court right in time for the 2020 elections. President Trump tweeted this morning, the deductible which comes with Obamacare is so high, it's practically not even usable, hurts families badly. We have a chance, working with the Democrats, to deliver great health care. A confirming Supreme Court decision will lead to great health care results for Americans, he wrote. So if you can respond to that and talk about an issue that's not talked about very much in the corporate media, and that is the issue of Medicare for all.
Well, that opens the door. I mean, if Obamacare, which is full of loopholes, excessive complexity, still 29 million people without health insurance, tens of millions underinsured, the corporations run away with record profits, drug companies, hospital chains, insurance companies, huge executive compensation. So if they overturn judicially, which is not likely, Obamacare, even the Wall Street Journal has said that this will open up the path to single-payer, full Medicare for all, everybody in, nobody out, much more efficient, and above all, gives you your free choice of doctor and hospital. You're not corralled in these narrow networks. And if you go on a network, you have to really pay tremendous price out of your own pocket. So that's what we're waiting the Congress to do now. The congressional committees, with their fat budgets and staff under the Republicans, have been sitting on their hands. They haven't been engaging in public hearings, Amy. They haven't been engaging in supervising the corruption in the executive branch. And we're going to present to the progressive chairs of the House of Representatives a whole list of hearings that have to be held in order to put these in play electorally, in terms of public opinion, and in terms of civic action.
absolutely right. He told it like it is. You know you did, Ralph. When Trump mentioned in his Twitter storm this week about how the high deductibles is too high for most people to handle, and so they need to get a new affordable care initiative to go on, you know what? He's lying about the deductibles. They're no higher than anybody else. What's wrong is the privatization of the healthcare system. I had went to a clinic here in Hawaii and was given a prescription for Flonase, but then when I went to fill it out in their inside pharmacy, they gave me a generic. Who's being billed for that Flonase? You see what I'm saying? And then when I talked to the doctor about it, he didn't want me for a client anymore, or a patient anymore. When it's happening right in front of your face. Because we know this year alone, as studied through the Johns Hopkins University, and as mentioned in my rare disease TV show, this year alone was 39 billion in billable fraud through healthcare. Ugliness. And Ralph Nader was absolutely right when he says we got to try to appeal it through the circuit court, and if not, it will end up going to the Supreme Court to affect the 2020 race. And I'm going to tell you, it's not going to affect the GOP like they think it is, because people want health care. And if Trump is saying anything right about this creating a better and greater health care, it should. It should open the door to Medicaid for all, or at least it should start opening the door for the progressives that are new in the House, the new 100 women and everybody that got in. Hey, 100 women getting in the House, turning it out. Need to go progressive and create that progressive caucus to at least do a single payer. Help the working class. AOC knows what to do. Don't just go Green Deal girl. And Rashida, you know what to do also. And Omar, go ahead and get that single payer, or that at least Medicaid for all going. Or get it on the table to talk about for 2020. Now, here in Hawaii, we did have a similar Medicaid for all policy that lasted up until the time that Obama brought his new ACA into effect. Now, there's people that have been dropped off and not being taken care of due to the fact that they are forced to sign up and pay. Some people just don't want to pay. Not that deductible, but they feel they have to go to the doctor, then see what's going on. Why do a penalty, or why do something ahead when you don't know if you're sick or ready to be dead? Just saying. Just saying. Now, what Ralph's new book is about is the ramparts, and how Bush and Obama's system has led to what's going on now, but it still can be fixed. So Ralph's book is offering solutions. Ralph is talking solutions. And unlike established media, CNN, TYT, and a lot of these other progressives that are out there, they are not talking solutions, and that's what we need more of. And what is the solution? To getting yellow vests and protests? Wouldn't that be good? Wouldn't that be great? Then maybe we can see some change happen in this place. It would be nice. But there's too much of a price to pay when we know we need to take care of the bad election system that is keeping those that are protecting the oligarchs within the system. That's what I'm saying. Now, the high price of going off network is what's going to cost people more if they don't pull into the ACA. Now, you need to help the working class. That money needs to be put back into there. And are you aware that if we don't take care of America's health and get a better single payer or care all program where we're not privatizing but monetizing, and not privatizing and monetizing the system, but correcting the system and making it accessible for everyone? Because right now, through Johns Hopkins, it's also been told that there are 5,000 deaths per week that are preventable, that are happening in hospitals every week. The mortality rate of Americans are going down. We're not living longer. We're not living as long as the previous generation that was in the Great War. We are not living as long as our mothers and fathers. My mother didn't live as long as her mother because cancer is more prevalent now, because there's more GMOs and processed foods, and we're not having a healthcare system to see to the needs of those people, which we need. And we need to get back to it quickly, because with better health, we can have a stronger economy and a working class that's wanting and willing to work instead of getting sick. And what is Congress anyway? Nothing but a bunch of old white people that should have been dead a long time ago if they had the same health care we did. That's why they can't relate. That's why they're not giving it to you. And you need to remind them who and what they are. They're not superstars. They need to put on their shoes just like me and you. And so they need to know what to do. And if you agree with me, contact me. Leave comments below. And you can always let me know what you want to hear or say or do at FeministNewsN@gmail.com. Don't forget to like and subscribe to my Feminist News Network YouTube channel and Facebook page. I appreciate you watching. Thanks for joining. And be safe out there during the holidays. Why? Because I said so. Be good now. Don't be naughty. You might end up getting some cold, because there's a whole lot of people in Congress that are. I know that's right. All right. Thanks for watching. Peace.